at Meharry Medical College, and she's talking about some of the issues dealing with childhood obesity. Dr. Bean, let's see if we might be able to pick up where we left off at the end of the second segment and give you an opportunity to elaborate upon some of the things that you're saying and perhaps bring in some additional information during the next 8 or 9 minutes that we have here.
Well, one of the things people need to realize that the epidemic of childhood obesity has in fact almost reached epidemic proportions. So we're talking about children who are less than 5, of which as many as 20% of them are already obese, and the obesity increases as the age of the child increases, with the highest incidence of obesity being among adolescents. So what do we do about it? The issues of how we haven't been very successful, by the way, in treating obesity, not only in children but also in adults. So preventing is extremely important. So the first thing that one should realize in terms of prevention is that every child needs a medical home. So every child should be going on a regular basis to see their primary care provider in the community, and that primary care provider should understand and be educated about how to prevent childhood obesity, should be monitoring the child at least on a yearly basis, and also counseling the parents on what they should do. And so what are we talking about what parents should do? It's relatively simple. We're saying you should decrease intake of fast foods. We're saying that you should have breakfast. Children should all have breakfast, and it should be a healthy breakfast and include fruits and vegetables, and that we should avoid as much fast food as possible. Not saying don't have any, we're just saying that it shouldn't become the primary way that a child eats. We found that, for example, families who eat together, the incidence of obesity tends to be less in those children. I will tell you that one of the major contributors to childhood obesity is adult obesity, having parents who are also obese. And so it's a family problem, not just a child problem. And that you really need to work with the whole family, and for the family to recognize the fact that this is a family problem, and the parents need to address their problem as well. We also recommend increase in physical activity. Adults should be getting at least 30 minutes a day of vigorous activity. That doesn't mean running, but it can mean a vigorous walk. Need to work up sweat. And children should be getting a minimum of 60 minutes every day of vigorous activity. Again, you want to have at least activity in which the child works up the sweat, the child raises his heart rate. So we want vigorous activity for at least 60 minutes. And it doesn't mean the child has to participate in organized sports, but it does mean that there should be an activity that's occurring that in the school, in the home. And again, these are things the parents and the child can do together. So we're promoting the family at the same time as dealing with a very serious health problem. If you don't deal with it, you wound up with children who are overweight and obese. And some of you may have heard of the term body mass index, which is the way we now measure it, which is just a way of measuring how much fat you have and classifying people in terms of that. And so it basically involves looking at your weight and looking at your height and calculating how much more do you weigh than you should weigh based upon how tall you are. And then, because, you know, there are football players who are not obese, but they're big. So we need to remember that. And so the body mass index on every child should be being calculated when they go in to see their pediatrician or family practitioner who is taking care of them. And then when we begin to see a child who has an excessive weight gain, then we should begin to talk to the parent about what you need to do to prevent it. Now, when we do wound up with a child who is overweight or obese, then we need to address the issue of why do we care? We care because there are lots of complications associated with it. First of all, if you have a child who has a problem already, for example, asthma, then children who are obese, their asthma is worse. And it's very difficult, much more difficult to control. We all know that obesity in childhood, obesity in adults, is a precursor for diabetes, and it's a very high instance of diabetes. We're now beginning to see diabetes, so-called type 2 diabetes. We're now beginning to see that in children. We're beginning to see that in children as young as 10, 11, and 12. That is almost unheard of. It was always considered to be an adult disease. It's now becoming a childhood disease, which is directly related to the epidemic of obesity. The issue, those adolescents is special, but even younger children, we're beginning to see hypertension. Again, that's an adult disease, but we're beginning to see hypertension in that particular population. Children who are obese have problems with sleeping. One problem is